We're here today at the Global School of Health in West Hempstead to find out what does it take to become a home health aide. Let's go inside and find out. My name is Dana Arnone. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Welcome to Senior Care Matters. I'm your host, Dana Arnone, and today we are coming to the Global School of Health in West Hempstead. I'm sitting with Shinelle Benjamin. She is the director of the Global School of Health. So, Shinelle, thank you very much for coming. So tell me a little bit about the Global School.
Well, Global School of Health has been around for 10 years. We actually celebrated our 10th anniversary this year in March. Global School of Health is a school that caters to the community in home health aid, PCA, EKG, and other healthcare classes.
So, Shinelle, what is the philosophy of the Global School?
The philosophy of the Global School of Health is to provide rigorous hands-on training to healthcare students to go out in the world and to be professionals.
They're so needed. Around New York, I know that there's a couple of different ways that people can get their home health aid or PCA certificates, whether it's through an agency or through a company like yourself. So you're funded through, you're licensed through Department of Education.
Yes, we are licensed to the Department of Education.
Okay.
And the New York State of Health as well.
So what is the requirements? Because, we get calls all the time and people want to know, I want to become a home health aide or a PCA. So in order to come to the school, what are some of the requirements that people have?
The requirements are very minimal. The requirements for both PCA and HHA, first of all, you must have a valid identification, picture identification. You must have a high school diploma. Now, if you do not have a high school diploma, we do have the ability to benefits testing that we give them here at the school at free of cost.
Okay, so let me just make sure that people understand. What you're saying is if they didn't graduate high school, that they can take the equivalency exam,
Yes.
and then they can, if they pass, obviously,
Yes.
they can come to the school.
Yes.
Yeah, because I don't think people know that that's an
Yes,
option.
the benefit exam is coming from the New York State of Health and the New York Department of Education that was approved by them for us to administer to these students.
Okay, that's good.
And they also need, for the home health aid students, they also need an updated medical physical in order not to attend the class, but in order for them to go to their mandatory internship. So those are the two most important things for home health aid. The high school diploma or equivalency to it, and a home health medical physicals for that.
Yeah.
The PCA does not need a physical.
Because they're not going into
internship.
they're not, right.
No.
And by internship, you're talking about an 8-hour day working
Yes.
as an aide.
Yes, as an assisted living.
Yeah. So, and that's something that you set up for them.
Yes, we set that up for them. And Global School of Health also goes beyond, and we also provide transportation for these students to take them to these sites.
Oh, very nice. So tell me a little bit about what makes a good home care worker or someone that's coming. I'm assuming you do some type of an interview.
Yes.
And you go through the reasons why they want to be. So what have you found makes a good home care worker?
To me, they have to be, first of all, compassionate. Mm-hmm. Compassionate is one of the things that we look for. They have to be loyal. We look for that as well. And they also have to have the drive and the love for the seniors and children as well. So we look for that. The most important thing that I look for as a director are students who come here with a drive and a passion, knowing that this is what I want to do because it's what I love, and I'm not just doing it because it's the only option that there is. So we look for that in the students.
But how do you explain to them that without those factors, it's going to be hard for them in home care because the thing is they're alone with the patient, and the patient is usually hard of hearing. The patient is usually living alone, or the family's at work during the day. So it's basically that patient and that worker in the home together. So the compassion is probably number one.
Yes, and so we also imposed on the instructors to make sure that when they are teaching these classes, especially in the skills, we teach them we impose on the instructors that how important it is to teach the students how to deal with various patients who are hard of hearing, patients who are disabled, patients who have mental challenge. So we impose on the instructors to make sure that these students are living here knowing how to deal with a diverse community out there in the healthcare.
Yeah. How do you show them that?
So we actually do hands-on training here. We teach them from the first step to close the door, open the door. We teach them how to knock. We teach them bedside manners. We also teach them privacy. That's why we have a lab that is set up literally like a home. And so we make sure that they get the hands-on training for that.
What do you think the biggest question or concern, I should say, that families have about hiring a new graduate home care worker? What do you think their number one question would be about, allowing that person into their home to provide that type of care?
Can we trust them?
Can we trust them? Exactly. So what are the part of the education that you give the workers? Because they have to understand, they're going into an elderly person's home for the most part. They're already scared about having people come in. They're here. We were just talking about this before about someone was just arrested for stealing money. So they're very timid and afraid to allow strangers in. So how do you have that conversation so that what my biggest thing is that I don't want the home care worker thinking it's them.
Yes.
Because it's not them. It's the person's feelings about the environment or what they've witnessed or what they've seen on TV. So when we do orientation, we're talking to the workers, we always let them know that just as uncomfortable, as scared as you are to knock on that door, that patient's just as scared to receive you. So what is that? How do you help them?
So part of the curriculum actually deals with that, how we deal with ethical issues. It gives you rules and regulations. The aides are not to accept gifts. The aides are not to take anything from the patients, remove anything from the house. Trust is gain. And so we teach the students that you have to go in there and the patient must trust you. You must make sure that you don't open a door from the first day that the patient has no reason to trust you. You want to touch anything, you want to open the refrigerator, you must ask permission for these things first. And that is actually part of the curriculum here. In the book, there are that they learn about the ethical and things that they should and shouldn't do. And our hope is that they take what they're learning back into the homes because they are taught these things here at the school.
The thing also is that we teach them report. So if something happens in the house, it's reportable to the agency. So, and sometimes they're afraid to report it, thinking they're going to get in trouble, they're going to be blamed. And we always tell them you just let us know what's happening. So do you go through reporting?
Yes.
Because I think that's something that lacks sometimes.
The last day or the day before finals, the instructors actually, for 3 to 4 hours, actually give them a printout and actually give them a template of how to do their reports. So we do it. We just started a few months ago because we have been getting feedbacks from you, the agencies, of things that the students are lacking. And so we take the feedbacks that we're getting from the agencies and we're working towards improving things here at Global School. So we have implemented some hours that we actually teach them how to write proper reports.
Can I give you a suggestion? So one of the things that bothers me is that when people enter into the field of home care, home care's had such a stigma and not a positive one for a long time. And so we're trying to change that, right? We're trying to change how the home care worker feels about themselves going and the profession that they're going into, how the families perceive the workers coming to the house. So one of the things that I find is that people don't respect the profession of being a home health aide. And so I tell them when they come, just sit up, be proud. It's a great job. And when you go to these people's homes, they want you, they need you. So, but they don't really understand that if you don't show up to work tomorrow, you just wake up and you don't want to go. That puts a burden not only on the agency, but it puts a burden on the family as well, because now no one's showing up. And we find that they just don't understand or don't, they just assume that the agency is going to send someone else, so that showing up is not always, they don't want to go. So I feel like that's something that should be reinforced in the schools when you're talking, that their responsibility is to the patient and to the family and to the agency, but also just not showing up is not okay. So, and really leveling up the profession.
So I also think, again, what we spoke about, that a lot of people that's going into home health aid, they're just doing it because it's an easy job to get to, and it's hard.
Well, it's an easy job to get, not to keep.
It's an easy job to get, but we have to find ways, and it's hard for us to determine who's really serious and who's not serious, because you may have a case today and somebody might call and say, oh, there's a better case over there. So there is no commitment. You have a patient and you're not scared to leave this patient because there is something better on the other side, and what it is. I also feel like too, a lot of them don't understand the culture of what they're getting into. And so we have to make sure that we're teaching them that this is not the patient. The patient is suffering from dementia, or the patient has Alzheimer's, and they might react to you differently, but it's not personal. And so some of them go into these homes and the patient may yell at them and they take it personal, and I'm not going back. So we need to start teaching these home health aid about the different sicknesses or disabilities that these patients have, especially dementia. Especially dementia, we need to really pay more attention to patients with dementia, because I think that's challenging for students who have never dealt with a patient who will curse them out or be mean to them, so they just think it's personal. So, because I've had a lot of feedback from students who said the patient was mean, the patient cursed at me, but they don't understand that it's because the patient is suffering from dementia.
Yes.
So I think,
important. It's time for a short break. We'll be right back with more Senior Care Matters after this.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need the most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Welcome back to Senior Care Matters. For the people watching, what's the difference between a PCA and a home health aide? The hours that the classes, that they're going to, but also what is the difference between their certificates?
So a PCA certificate, they come here for seven days. They don't have as much hours. A PCA is basically just placed in a home just to help with the patient. The PCA doesn't have the ability to administer medicine or to take temperatures and stuff. They're just aside with the patient. They do not have to go on internship. Their PCA certificate is administered by the New York State of Health, but it doesn't expire.
Yeah.
Whereas the HHA certificate is a more advanced, it's like an upgrade to PCA. They have to do 84 hours of training. They must go to mandatory. With HHA, you can work in an assisted living. You actually can take temperatures. You can do feeding. You can bathe. You can do Hoyer lift, but PCA you cannot.
Mm-hmm. Do you find most people are coming for the PCA or the home health aide?
The home health aide, because there are more opportunities out there in home health aides right now. And we're also having an influx of students who are upgrading from PCA to HHA.
Mm-hmm. Oh, they could do that here too?
Yes, we do offer the PCA to HHA upgrade.
Do you you also offer CNA classes?
Yes, we do offer CNA classes.
Is that that's regularly same as the home health aide?
No.
So let's explain a little bit the difference between a PCA, which is a personal care aide, versus a HHA, a home health aide.
So patient care personal care aide is a less demanding course. It's just it's a 7-day program where students come in and learn the basics. They're not required to go on internship. They basically just provide basic needs for these patients in terms of feeding. They're not allowed to bathe and shower and take temperatures and stuff, whereas home health aide is a more demanding. It's 84 hours. Home health, HHA is home health aide, where they work in the home with the patient. They help the patient with cooking, feeding, bathing, taking temperatures. Some home health aides also take the patients to some of them are allowed to take the patients to their appointments.
So the other classes that you are is the CNA class?
Yes. So an upgrade from the HHA is a CNA, which is a certified nursing assistant, and it's 18 days for CNA. CNA are allowed to work in hospitals. CNA has to do 30 hours of internship. CNA is not too different from HHA. The difference between CNA and HHA is that CNA has to have a license administered by the board, by the New York State. So they have to go and do a license in order to work as a CNA. Whereas HHA, you just get the certificate. So it's just a little bit different. But CNA is an upgrade from HHA because you can work in hospitals with a CNA license.
Right. So let's talk about funding for the different programs that you have and partnerships that Global Health has. Do you deal with some workforce development?
Yes. So some of the students fund themselves, but we also are now collaborating with Hempstead Works, Workforce, and Access VR. Access VR, we are excited to work with Access VR because Access VR sends us students who have disabilities and are trying to get them back out in the workforce. And so we are excited to start collaborating with Access VR, but Hempstead Works send students to us and fund the students, and so we are just started collaborating with them. But majority of the students also fund themselves as well.
So, and the cost is different between the different certificates, I assume, like the cost of the
yes, the cost is different.
And Hempstead Works, do they cover for the CNA as well?
They're covered for whatever students they have, they send them to us.
Interesting. Okay, so if somebody wants to go to school to get their certificate, they can call and they don't have the money to afford it, they can call.
Go to the Hempstead Works.
Okay, and is that just for Nassau County?
It's just for Nassau County. But we also have the patient care technician, which is one of our highest
Yes.
level, that some of the students come here with $11.99, where $11.99 actually reimburses them for the classes.
Yeah, that's my whole thing when we're talking to the workers that come to work for us, because we're a union 1199 agency. I always say you have an opportunity to do a good job, get a decent rate of pay, but also you have the opportunity, and a lot of them don't utilize it. I don't understand why, to go to school, and 1199 will help them. So, and those are the things that I talk about a lot, that I want everybody to go into home care and home health aid. So we go and we speak to nursing students at colleges, and we tell them that, while you're in school, nursing school, and it's so hard. My daughter, did it. She was a nursing student at Adelphi. We got her sorority to take the classes, and they all became home health aides and worked while they were in college. I think it's a good way to reinforce, the first of all, empathy, and also, they need to understand, that home care is a very vital part of the healthcare. So, being these relationships and 1199, do you have students that come here now that reimbursed?
Yes.
For it? Okay. For people that don't know, 1199 is one of the largest healthcare unions, and I know that they do have a career ladder and support systems for people to, continue their education. So is that something that you've seen here as well?
We have seen that for students coming to study patient care technician, PCT. These are students who are already working in the field in the hospitals, and so they're coming here. PCT is a combination of CNA. So these are students of CNA, phlebotomy, EKG. So they're coming here to do phlebotomy and EKG because they would have already have CNA. And so these are students who are already working in the hospital field, some of them as CNA, and so 1199 sends them here to do PCT, and they do fund them. They do reimburse them.
Reimburse them. Yes. What is the schooling for that?
The PCT program is 130 hours, and so we have day and evening classes. Day is 18 days. Evening is 22 days. After that, we provide a certificate. They must go and do the license through the National Health Association. It's called NHA, and our school is also an approved site for them to come and do the test through NHA.
Yeah,
so they must
great.
have the license to do that.
The opportunities are unlimited, especially here. You're offering all of them under one roof. So I think that's great. So as far as when you're talking about the global health moving forward, I've seen, because I come to your graduations, I know that you guys probably have 100%, job placement, because anytime I come, you're full. And people are eagerly ready to talk to the agencies that are here to employ them. And they always, for us, when they start, they want to work.
So we just don't offer classes and just give them a certificate and leave. On graduation day, as you can see, we bring in various agencies in HHA to offer these students job, and we follow up. We follow up with these students, and we say, okay, you haven't gotten a call yet. We say, okay, call this agency. And so our hiring rate is very high because we follow up with the students and make sure that they're being placed at different agencies. And we encourage them to just don't sit and wait. Move forward, call a next agency. And so we provide them with ongoing support once they graduate.
Yeah, I know that's true. Not every school offers that kind of, when you come here in the graduation, it's like a real graduation. You have a real ceremony, makes them feel good. And you have multiple agencies here so that they, they're not being funneled to one, because that happens in a lot of these schools. They funnel you to an agency that's basically paying to be there. And I have to say that here, you have, like 5 or 6 agencies all here, and have the equal opportunity to talk to the students. And I think that that's very refreshing, that you're just giving them, do what's best for you and what agency you want to land with. I do think that 1199 has helped a lot of people move up in their career when they start as a home health aide, and they can do whatever they want. So where does Global Health see themselves moving forward? Because one of the things that I noticed at the graduation was that your graduation was not as packed as it was prior. Yes. And I'm feeling, that it's part of the immigration status of people. So why don't we talk about, the students are still coming. you want people to come. They can feel safe coming here, right? That nothing's going to happen to them. But definitely, I saw a change in the graduation.
There has been a change in the numbers of registration, unfortunately, because of our school caters major to immigrants from the Haitian community, the Spanish community, and so our registration has declined a bit, and that's why we have collaborated with Hempstead Works. So we are going out and letting the community know that we are still here. We still care for you. You are protected here at Global School, because the last graduation that you were at was one of the first graduation that since the decline in registration. So they are starting to come back because we are making it known out there that we are still here. There's still opportunities for you. We are here to help you, and so that's the marketing that we're using now.
No, so the thing that we've seen on ours too is that we do get students coming in, graduating. But I would love to know, like, how are we going to continue this? Home care crisis that we have now, not enough workers as it is. We're running into all sorts of problems with overtime for the agency and things, because we're losing workers as well. And the schools are not, replenishing, I guess, the pool of workers because people are afraid to go to school. So how is it that you guys are combating that? And
so I think right now our best strategy would be to focus on who is able to work. And so we are trying to get even into high schools where we can start talking to to seniors about home health aid is something that they can just come out and do. And so we have to now target not just immigrants, but people who are just ready to just come out and try something new.
For us, we're always trying to tell the workers that their job is the most important job that you can ever provide for someone who wants to stay at home. And you can't give that peace of mind to the families if they're worried about who's taking care of their loved one. So there's so many different ways for people to enter into the career of home care, but also how wonderful it is and how and flexible it is. And it really can be, a way for someone to make a second type of income. Thanks for watching Senior Care Matters. I'm Dana Arnone, and we'll see you next time.